we need to make sure our listeners understand, like, mini doesn't mean better.
No.
Right? I mean, how many times do you see like minis that are just not great, that just needed a full?
And I think the listeners really need to understand this, because a mini in our hands, what I understand a mini to be, could be different than what another surgeon calls a mini.
Mm-hmm.
Welcome to HKB Uncut, the health, knowledge, and beauty podcast.
On this show, we unpack the newest techniques and trends in cosmetic surgery, how to tune out the social media noise to make empowered decisions about your appearance, and what you need to know before you book a procedure.
I'm Dr. Bill Kortesis.
And I'm Gaurav Bharti. We are board-certified plastic surgeons and co-founders of HKB Cosmetic Surgery, an award-winning practice with 11 locations across 6 states.
In other words, when it comes to aesthetics and cosmetic surgery, we've pretty much seen it all, and we want to share our knowledge and unique approach to aesthetics and beauty with you. Whether you're interested in cosmetic surgery for yourself or want to separate fact from fiction in the plastic surgery world, we hope you'll tune in each week.
Hey everybody, it's Gaurav Bharti.
And Bill Kortesis.
Bill, today we're going to talk about mommy makeovers and kind of things like options, timing, recovery, who's a good candidate, and just kind of get into some of those details. First and foremost, what is a mommy makeover? I kind of hate the word, but it kind of works. But what is it?
You know, these are great procedures. Honestly, it's one of your and I passions. Mm-hmm. We do a lot of these procedures. But in essence, it's any combination of breast surgery with body contouring. It's been named mommy makeover because a lot of times women post-children come in to have their bodies restored. They want to get back to where they were pre-babies, and potentially even better than they were pre-babies. Mm-hmm. And that's why it's been called the mommy makeover. But I think in a generalized term, it's anytime you do body contouring surgery. And what does that include? Liposuction, any variation of a tummy tuck or excisional tummy surgery with breast surgery at the same time.
Yeah, and sometimes it could be an eyelid surgery, it could be a facelift, it could be a labiaplasty. So it's really anything after the amazing women that we're surrounded by, have, given their bodies up to bring new life into the world, and they want to reclaim what's theirs. Is it all cosmetic? Is it all just aesthetic, or is there more to it than just like they just want to look better?
No, a lot of times it's more than just the aesthetic part, right? Babies take a toll on a woman's body emotionally, physically, you name it, it does a lot. And oftentimes, from a physical standpoint, when you have a child and you get pregnant, your rectus muscles that sort of hold everything in place and keep your posture and keep everything nice and your core nice and tight, separate. And especially after multiple pregnancies, they separate even further. And so the way to restore that functional status for that individual is actually repair that musculature. And unfortunately, I get asked this question all the time, and I know you do as well. Can diet and exercise fix it? And unfortunately, no. It takes an individual like a plastic surgeon to come in and actually do the procedure to repair that rectus muscle.
So I've done cases with you a couple of years ago, and I've done some myself where we've actually taken care of women who are, these are the fittest of the fittest. They could whoop my, they could whoop yours too, that are true fitness junkies, trainers that had multiple kids that are shredded, but they still have a diastasis, which is a separation of six-pack muscles. So, actually performing that repair obviously gave them a stronger aesthetic look and gave them a stronger core, but like functionally really enhanced them. And so I think it's really amazing how you can actually improve someone's function. So, we love aesthetic surgery because so many times out of most, or more times out than others, we can actually improve form and function. Sometimes all the extra skin, like when you have that extra skin, that ledge or breasts that are sitting and touching the skin of the upper abdomen, women hate boob sweat. There's one thing I've learned, they hate boob sweat. And getting rid of boob sweat is like the best.
I think women hate sweating anywhere, not just in the boob area. But it's crazy. You bring up function thing. How often do you do a tummy tuck? The patient comes back and they're like, "Hey, dog, my back pain's gone," mm-hmm. Or "Hey, dog, I didn't realize it, but I had some incontinence and that's improved."
It's amazing,
right? Like it's just amazing. You do the procedure, it takes care of that distinct problem. So again, to your point, we're taking care of both their functional status as well as their aesthetics. When people talk about the body contouring, like what options are we looking at there for a patient? And then I'm going to go into fine-tuned details because patients always come in, they're like, hey, doc, I want a mini tummy tuck, reverse or full. But I will get into that in a second. But let's talk about options for the tummy part.
Honestly, it's I would say that it's a combination of like what their anatomy is showing you, like what the issue is when you examine them, but also what's their concern. Like too often, like one thing we can't do as plastic surgeons, we can't be like, this is what you need, young lady or young man, if we're doing male surgery. It's got to be like, what's going on? What can we do to help you, feel your best and reconcile with how you feel with how you look? And the same is with like a torso or a tummy. Sometimes they're like, I hate my belly button. I hate these stretch marks. I hate the ledge. I hate all this skin excess. Or I just feel like I'm like pregnant all the time and I'm not. People are asking me, how many weeks am I? And it just pisses me off. And I think those are the reasons where it motivates some women to come see us. Even the ones who are like, I'm never, ever going to have a tummy tuck or surgery. I think, it has this little stigmata. Like a lot of women, they want to be natural. They don't want to have a elective cosmetic surgery. I mean, these ladies are working, they have kids, they got real responsibilities, and who the hell wants downtime? But I think it depends. Like, so some women, depending on what their anatomy is like and how much excess they have, they could be a candidate for what you were talking about earlier, a mini tummy tuck, right? Where there's basically no skin excess and it's all muscle separation. But most of the time, that's not the case, right? And you need to do some form of a full abdominoplasty. So, sometimes they're just like, well, mini just sounds so much better. Well, like, we need to make sure our listeners understand, like, mini doesn't mean better.
No.
Right? I mean, how many times do you see, like, minis that are just not great, that just needed a full?
And I think the listeners really need to understand this because a mini in our hands, what I understand a mini to be, could be different than what another surgeon calls a mini. Mm-hmm. Right? Some people call a mini not doing anything to the muscles.
Right.
But what does a mini tummy tuck mean to you and I?
Yeah. So a mini tummy tuck means that there's muscle separation, diastasis, that's going to be corrected. There is excess skin below the belly button, okay? Not much excess skin above the belly button. So when they're sitting up like this, there's not too much skin here. There's skin down low below the belly button, and there's a muscle separation and very little fat. She could potentially be a candidate for a mini tummy tuck. But still.
And for you, that means you're plicating that muscle. You're repairing that muscle all the way.
Stem to stern.
Correct, right? Where some individuals won't do it above the belly button.
I can't tell you how many times I've had people, and you've had this too, where they come in and they say, yeah, the doc said they could only, for a mini, they just tighten just from the pubis to the belly button, which makes no sense.
It doesn't. So how do you address the upper part of the abdomen in those cases where, again, minis aren't minis everywhere? So how do you address the upper abdomen?
Yeah, so then there's the concept of umbilical float. So what you do is you dissect all the way, you lift up the skin all the way to the belly button, and then you separate the belly button off the chest wall. You actually do something called a float, where you don't make any incision on this skin flap, but you lift it up, and then you have to work through a tunnel. So it's a little bit more work. You have to put the patient in deep Trendelenburg, obviously have him laying back, and then you dissect all the way to the xiphoid process here. And it's a long tunnel sometimes. So the reason why most surgeons don't do it is because it's a pain.
Yep.
It's harder to do.
It's a much harder procedure than a regular tummy tuck. But again, a lot of patients don't necessarily know that. A mini is more difficult.
But the overwhelming majority of patients have stria, which is stretch marks all around the belly button. They have looseness up here. When they sit, there's almost this roll effect. And they want to get rid of that. And so most of the time, you need to do a full abdominoplasty. And a full abdominoplasty is more effective at getting rid of that skin excess.
You're still taking care of the same problems. You're removing excess skin. You're tightening the muscles. We typically end up doing liposuction with either one of these procedures. But the difference is what you do with the belly button.
Right.
Whether or not you have a scar around the belly button.
Right. You have a scar on the belly button. And like, I'm going to tell you, like, most of the patients who are seeking myself out or you out, I don't know about you, but they're like, I like your belly buttons. And it's an interesting concept, and there are different kinds of belly button aesthetics that we can do it however you want. So if you have a belly button that you like, it sounds crazy, but bring it in. Let us see, because like we literally can alter the approach to get that belly button. There's a lot of times patients will come in though, and they'll have this concept of like, I need a short scar. I need a short scar. I don't want a long scar. Oh my God, that scar mortifies me. It's one of those things where I think we have to get them to understand like. You obviously want a short scar, but you want the best outcome. You want the best contour. So scar length. I mean, are you trying to keep the shortest abdominoplasty scar every time?
No, I'm going to be honest with you. The more I've been doing this, the longer I've been doing this, patients care about scars, but they don't. They care about their aesthetic outcome, what it looks like. If you put the scar in the right location,
Right.
where they can hide it under their undergarments, bikinis, whatever, they're fine with that scar.
Yeah.
So I think it's more of the overall aesthetics. I think the most difficult patient in terms of body contouring, as we were talking about from the mommy makeover combo, is the patient that's in between a mini and a full tummy tuck, right? I think those patients are difficult because what we're talking about is a nuance here. If you can't remove all the skin from above the belly button to that scar location, oftentimes you end up having to have a vertical scar.
Yeah.
And so those patients are in between a mini and a full tummy tuck. And sometimes it's difficult to explain that to a patient and let them, but you and I both approach it the same way. We let the patient decide on what they want.
Totally. And we're not opposed to other concepts. And the biggest thing is we don't want to do the same thing every time. So we can do different things. So in those patients, I had a patient who I was actually had scheduled, but then she decided, no, I want the maximal tightening, and we changed the approach. But on that patient who had a similar thing you were talking about, what we did is we did a hybrid or a kind of a composite abdominoplasty. So what we can do is you can do a mini approach. So you do a mini approach inferiorly. You do a small reverse abdominoplasties in the breast folds, and then you do Renuvion with it and skin tightening. So at the end of the day, it really is up to the patient, right? And we can kind of come up with novel, innovative approaches, and so that we can basically get what you want. The main thing is just setting expectations. For us, it's like at the end of the day, we just want patients to come back and be like, "Oh my God, you did exactly what you said you were going to do, or you did a little better." Yep. You don't want to under-deliver. That's the only thing. We want to over-deliver, or at least meet expectations. One thing that we haven't talked about yet, which is really important, is that almost every mommy makeover, quote unquote, or body contouring procedure after having kids is associated with posterior truncal approach, to meaning what do you do? And a lot of times patients come and say, hey, have you any concerns back here above your buttock in that hip roll area? And a lot of times they're like, I haven't really thought about that. And I always bring it up to them, but why is it important to have that discussion and approach that area?
Again, when we look and evaluate the patient, we're not taking care of just a patient in two dimensions. We really want to take care of the whole unit collectively. And I think if you do that, you get an ultimately better outcome. So I bring it up with every patient. Hey, let's look at your posterior trunk. Let's look at your lower back to see how it complements the front, to see whether or not something needs to be done there. Yeah. Oftentimes it's just liposuction. Mm-hmm. Occasionally you need to extend the incision a little bit further back. Sometimes we need to address the buttocks area because, again, it's a common misconception. A lot of mommies come in and they're like, I don't want a Brazilian butt lift. No. I don't want fat grafting, because they don't want what they understood fat grafting to be the buttocks. But you and I have a slightly different approach in the fact that we're doing it more for shaping than we are for volumizing. Right. And that's a pure distinction.
It's like volume redistribution, right? The other thing I would say is that that I would say the modern or the contemporary mommy makeover at HKB, we are always reconstructing the muscle core. We're trying to eliminate skin excess and give natural, elegant, athletic contours. We're trying to address areas that have lost volume, like the buttock. We are removing skin when needed, meaning we're not afraid to remove the skin and do longer scars to get a better result. And then the other thing is going to be is breasts. When we approach breasts, the breast aesthetic now is definitely a more natural, less of a va-va-voom, but for the right patient, we can do that all day long with traditional implants and breast lifting. But there's a huge subset there where I would never ever have anything to my breasts, but I just wish I fit a little bit better in my bra. And they're not necessarily droopy, they just don't have it. They just literally, the kids suck the life out of them. And they just want to be a full A, or they want to be just a small B. They literally want to fill out their bra. And I think we should talk about kind of our approach on that and what's changed recently that is really expanding our space.
I just love the fact that there's so many different options available to patients when it comes to breast surgery. And I think the first thing, I know where you're hinting at, and I'd love for you to chat on it. But what I'll tell you is breast surgery is so individualized that every patient that comes in wants something slightly different. And it's up to us as surgeons to figure out the exact look that the patient's going for, give them all the options around what we can do, show them, and set appropriate expectations. Because to your point is, some patients are like adamant, I don't want an implant, doc. I just can't. I'm just not going to do it. I just want to restore kind of things back in the right position. I'm okay with this. But you need to show them what a lift will do to them, and it may not give them that roundness up top, right? And sometimes they need, an additional device there, like an implant, to give them that volume. But we do have alternatives, right? Back grafting is actually an amazing alternative. Now, it doesn't do a great job of volumizing in certain areas, but it does give you good shape, which is great. But again, and it's all individualized.
And the other thing too is like, so this is important because this topic of this conversation is mommy makeover, and it needs people need to understand that doesn't mean you have to have a big ass surgery. It can mean you have a small thing done, like you have just your breast done. But some mommies are afraid. They're afraid. They're like, I have kids. I do not want to get anesthesia. I'm freaked out about it, and I just can't. It's too selfish. And I'm going to tell you that I've had several cases I've taken care of recently where we do a small volume enhancement. We're using a new novel technique that HKB was one of the first in the entire country. You and I were one of the first people in the United States to even use this technique 5-6 years ago. That was even more advanced technique, but using this concept of preserve, where we're doing these procedures on women who want a small volume enhancement, who want essentially no pain, no recovery, and don't want to have, hopefully not have anesthesia. If they don't want it, they can have anesthesia. They can have some sedation, and it's pretty remarkable. I will have to say that initially I was even I was kind of like, I don't know about this. I don't know about this thing under local anesthesia, and then I did it, and you've been a part of it, and all of our team's been a part of it, and I think it's really remarkable that there's an option available. There are multiple options actually available for women who are interested in doing something, but maybe for the ones who are like, why, I just can't, because I can't have that time off. I can't have anesthesia. Well, you don't have to.
You can have that under local anesthesia, be out and about within a couple hours after having
It's crazy.
surgery.
Which is wild.
Which is really impressive, and go about your daily activities the next day.
And I think, though, what that does reminds us, though, that it's important for people, and you've been a huge proponent of this, and a lot of other people in our space, about this kind of concept of early active motion, returning to activity, moving, grooving, because if you don't use it, there's always been the term, you lose it. Well, after surgery, it can be dangerous if you're not moving around. So actually moving around, being active is really important. And so even with these big surgeries that we're doing, the night of, even if you're doing a circumferential abdominoplasty and a breast surgery, like a big 6-hour surgery, they're walking.
Yeah, it's controlled motion, right? If you do it the right way, you're actually benefiting the patient long term. So big proponent of it. One of the things that you and I do a lot of, not talked about a lot, but it's something that can also be done under local anesthesia, and we've both done it under local anesthesia. It fits into this mommy makeover category, is the C-section scar revision. Mm-hmm. How often do you have patients that come in, they're like, doc, I look great. I'm one of the lucky few. I didn't have any issues. I don't need a tummy tuck. But what drives me crazy is when wearing my yoga pants, you can see this little bit of a ledge.
Yeah.
What causes that?
Yeah.
And how do you address it and fix it? Because we do a lot of it.
What he's talking about is when someone has a C-section, especially if they've had multiple C-sections, there tends to be this concept like an invagination, or it's like this valley that is formed. So there's a ledge above and a ledge below, and there's a tether where the actual scar is stuck to the abdominal wall, and it's caused by when at the time of closure, especially if there's secondary procedures done, where the skin is kind of brought together, but the deep stuff. Everybody, even the skinniest of skinnies, has a little fat layer that's under there, and that's called that subcutaneous fat. And there's another layer called a scarpous layer. It's like a investing fascial layer. That tissue normally exists. So when that tissue exists, the skin's there, and there's a whole layer below that's attached. When this is healed, it's healed like this. So it's just skin, and then the abdominal wall fascia is there. So there's not that buffer layer that's in there. So that won't typically go away. Now, people would say, well, I'm doing cupping, I'm doing massage, my physical therapist is working on this, all this stuff. And it doesn't go away completely. It won't just disappear because there's a void of tissue and scar there. And so we can do this, and you're right. A lot of times we'll add this on as a little additional procedure. Sometimes it's a focal procedure where you just literally excise that area, excise that valley, and then when we close it almost in the opposite orientation, where you close it kind of heaped up just a bit, so that when it comes down and relaxes, it's flush and that deep tissue is connected there. But that's a really interesting thing to do, and has pretty much no real downtime. And
You're
it
basically using the same scar that a patient already has, maybe a little longer, so we can cut everything out, and you take care of the problem. Success rates are super high. Patients are over the moon ecstatic about it, and a lot of people don't know that that can be done.
totally, yeah. And it just goes to show that it's like we say this. I feel like a broken record that everybody's unique, and all of our moms are unique, so they will likely have an interest in unique, different things, and that basically anything can be done, and it's figuring out kind of what's the best situation for them, and then also like planning. I would say one thing we can talk about before we close out is this idea of like, when is the right time? Like when should they do this? How do they figure out what's the right time? How much help are they going to need?
Well, I mean, I think there's a couple hard, fast rules, right? Without a doubt, that we can go ahead and cover. If a mom is still breastfeeding, you need to hold off on that 3 to 6 months before you end up having breast surgery. So that I think that's a hard, fast rule that most surgeons ascribe to. The second one's weight loss. We kind of want you to be at kind of your steady state weight where you're going to want to live.
You don't necessarily care what the weight is.
No, people always say ideal weight. I really don't care about the ideal weight. What I don't want to see is fluctuations of weight.
Right.
I want to be at a steady state for a period of time. Then I'm okay with you doing surgery. And I think another one is, this one's not a hard, fast rule, but it's one to consider is, are you done having kids or not?
Right.
Right? You've already had 2 kids, you're contemplating a third. Do you go do surgery or do you wait? Or, and that's a topic in of itself. But I think the first 2 are pretty kind of, hard, fast rules. The third is something, hey, you need to have in the back of your mind to think about before you go down this road.
And how about what should they do to prepare? Like, what do they need to think about from a logistics standpoint?
Yeah, I mean, you got a couple things to worry about, right? You have to find somebody who can take care of you post-operatively, because that first week to 10 days is rough. I'm not going to lie. I mean, depending on the type of surgery you do. If it's just breast surgery, a little bit of scar stuff, relatively easy recovery. But if you're talking about a full tummy tuck with muscle plication, big surgery, big recovery, you're going to need some assistance for that first week to 10 days. So think about having somebody to help you figure out what your home situation's like. Does your spouse work? Can your spouse be home with you? Who's going to help with the kids? And I'll tell you, those are important concepts to think through. So timing is really important. So think about that before you actually schedule surgery. Right. Do you have any other big ones that you like to talk to patients about?
No, I think it's I think if they're thinking about this, I think it's always a good idea to come in and talk it out with us, have a consult. I think that it's always good to just kind of prepare and understand kind of what it's going to entail. The other is I want to tell patients is, if they're, whoever's going to be taking care of them, or their spouse or family, they can come in too, so they can understand the gravity of it, understand the situation. And then also a little bit about like kind of how going over practical things, like making sure they know like when they can pick up their kids, when they can drive, when they can sit for long periods of time,
how they're going to sleep.
How they're going to sleep, right? And then other strategies. When we're around so many patients, and if you deal with family members who've had this, like the real deal, like what kind of recliner you need, when you need a walker, when you need X, Y, and Z. And I think that those are really important. And the other is like getting them actually to talk to other real patients. Luckily we have a lot of patients who will vouch for us and talk about kind of their experience. But I think this is one that, it takes a little bit of planning. It's very important. It's a big deal thing. We take it very seriously. At the end of the day, I tell patients, and I'm sure you feel the same way, like we care more about their outcome than they do. It's so, so important. And so we don't take any of this lightly. Obviously from the standpoint of we want them to be happy, but we also want them to get back to their normal and be the incredible people that they are for their families, for their spouses, for their workplace environment. And so it's a big deal thing. And I'm lucky to have such incredible women surrounding us and getting to take care of them on a day-to-day basis.
It's not dissimilar to, the delivery process and the post-delivery process in regards to the fact that, women get pregnant. There's a lot of research done on pregnancy, how the pregnancy part will go, how the delivery part will go, and then there's the aftermath of the baby, right? And then they're like, "Oh my God, what just happened to me?" Right? And similar is having surgery, right? Like you do all this preparation in regards to, all right, I'm having surgery. I'm doing all my homework. Is this the right surgeon, right place? Am I getting the right procedure? You have the procedure, and then you're like, "Oh my God, here it is." And I know you think the same way. It's like recovery is just as important. And like, we're really big on making sure that they have access to us, they have access to our team, that they have access to all our recovery tools that we have here, all our nursing staff, because that's a big part of this, right?
And the other thing too, you're alluding to, I think, but if not, I'll bring it up, is when women have kids, there's this postpartum blues. There's 100% post-surgical blues. And it's a normal phenomena. And so for patients to understand that going into it, but then also for family members to know that too, so that they know that like this is going to happen, and it's a common thing. And I always tell patients when they have this, like, you're going to have this done a day or two, and your maximal swelling is going to set in. You'll be uncomfortable and be like, "Oh, why'd I do this?" And you'll look down and be like, "Oh, okay, I did it because I look awesome," and it's going to get better. But there is that happens. And
there's a nice love-hate relationship. Like, you're really excited.
Sure.
Day 1, day 2, you kind of don't know what's going on. You're like, oh, you expect that. It's really around day 4 to 7 that you're like questioning your sanity and going, oh my God, did I do the right thing?
Right. And a lot of times it's because you have to be idle. You're not doing all your normal stuff. And like, once you kind of immerse yourself back into like life, it's actually better.
You and I both have had surgery, and I'll tell you, it's tough. And, it helps you empathize a little bit with patients and to know what they're going through.
Yeah, I was a crazy patient.
And emotionally, it's a roller coaster, right? Sure. It's definitely a roller coaster. And just, lean on your team and the staff and the docs to be there for you.
Well, we appreciate everybody listening. Mommy makeovers are really a tremendous amount of fun. They're super satisfying to us. Any questions that you have related to this topic, please hit us up at any time via our social media platforms, and please tune in to our podcast going forward.
Thank you for listening to HKB Uncut. If you enjoyed this episode, please subscribe to us on Apple, Spotify, or YouTube.
To book a surgery consultation or med spa appointment with our team, visit our website at hkbsurgery.com or head to the links in our show notes.